Okay, we will start now. Bismillahirrahmanirrahim. My name is Rana Kamran. I'm a PharmD pharmacist from Bahauddin Zakir University, Multan, in 2012. And I have recently passed my board certification in pharmacotherapy. And I'm studying my master's in clinical pharmacy from Gulf Medical University at Ajman as well. I'm working in UAE from last 7 years, and currently I'm working in ADNOC clinic, which are under the RPM group of the VPS. If you have any question, if you have any queries, or please raise your hand because your mics are muted. And if you have any question during the session as well, you can just write in the chat box. We will respond it to you. So yeah, so I hope we will start right now. As you know about the giving back to pharmacy in Pakistan, we have our own vision and mission as well. You can see this is to empower the pharmacist for the better healthcare. And this is an organization of the volunteer pharmacists from around the world aiming to refine the pharmacy profession in the Pakistan, sharing the best practices and engaging the relevant stakeholders. This is our mission, and under this mission of umbrella of giving back to pharmacy in Pakistan, we have started to educate our participant or our pharmacist, registered pharmacist having an experience in clinical to start getting the knowledge of pharmacotherapy. So we are going to launch this, and I hope we will be successful in launching, and our students will get a lot of knowledge from our lectures. So what are our future goals? I want to discuss here. To increase the number of certified pharmacotherapy specialists in Pakistan. Right now, currently in Pakistan registered, we have 13, but we want to make it 50 by 2025. Because in future we are having a great demand of a clinical pharmacist with the background knowledge of the pharmacotherapy. So we need our pharmacists to register and should be board certified under pharmacotherapy. And we have the plan to introduce the preparatory classes of BCOP, BCID, BCACP as well in 2021 and 2022. So this is our first classes of Bcps. Then we will start the other classes as well soon. So various workshops, including quality, safety, process improvement, smoking cessation best practices, and establishing a quality research. So this is all we have the future plans, and I hope with the help of our volunteers and all board members and the core members, we will be very successful in launching all of this program. This will not only increase the knowledge as well as the skills of our registered pharmacists in the Pakistan to work well in their domains. So this is our own annual conference, which is going to be happen in September 17 and 18, 2021. You can see, you will get this invitation soon as well. This annual conference annually under giving back to pharmacy in Pakistan, it's happening. So it will be in 17th and 18th of September, inshallah. So, and you will get the e-certificate for this as well. So first of all, I want to introduce our faculty members and volunteers who are working with us. I want to really thankful by heart to our faculty members who take their time to help us and to help not only us, all the pharmacist community in Pakistan to get knowledge, because these people are well educated and well skilled as well, and they are working in their fields. Muhammad Bilal, he will cover neurology and nephrology. For pediatric, we have Saba Javed, and chronic and acute care cardiology, Muhammad Bilal as well. And fluid electronic Electrolyte and Nutrition and Critical Care by Ghulam Mushtaba. Ms. Maria Shokat, she will cover the geriatric, and endocrine and metabolic disorder by Muhammad Ammar Zahid. Ms. Shama Arfan, she will cover the general psychiatry. Mansoor Ahmed Khan, he will cover the oncology supportive care and gastro disorder by Uzair Ahmed. Infectious disease by Dr. Sidra Khan and Dr. Rehan Khan and Zafar Iqbal, and Muhammad Rehan Khan and Sidra Khan for the infectious disease too. And policy and practices by Mr. Asif Javed Awan, anticoagulation by Zafar Iqbal again, and pulmonary gout immunization and pharmacokinetic by Mr. Muhammad Zishan Khan, and biostatistic and study design. I will be there with Arisha Ayas. My lectures are already on the YouTube available, so I will accompany her. Men's and women healthcare for Aisha Tabinda. For the volunteers, right now I'm very thankful to Dr. Siddiqui. He's working with us and he's accompanying me, he's guiding me, and I'm very thankful to him. All the day and the night we are in contact. Obviously, I'm leading this Rana Kamran Mahmood, and I'm very thankful to all my 4 volunteers, Dr. Anam Malik, Afia Haq, Priyanka, and Rida Islam. I'm really very thankful to these girls. They are really working very hard to make this event successful. And in the next coming 3 months, they will be in contact with us, and they will coordinate with us and with all of our other faculty members and participants as well. You will get the emails through these volunteers. So once you will get any email from them, just add them in the contact. So if they will send the email in the future, it will not go into the junk or spam folder. So what is actually pharmacotherapy? I will explain you. The pharmacotherapy ensures the safe, appropriate, and economical use of the medication as a part of the interprofessional treatment team in a variety of settings, including hospital and health system. So this is actually one of the part of the clinical pharmacy, and you are not only for the safe and appropriate, but the economical use of the drug as well. And it's not as you are not playing single, but it's an interprofessional collaboration is required for this. So if you want to go for the certification exam, it need a 3 year of experience after the graduation. They have mentioned the experience at least 50% in the pharmacotherapy. So it doesn't make any problem for the participant. Once you are going to apply for that, whenever we will apply, just remember you must have 3 years difference between your graduation and currently. So there should be a 3 year gap. Otherwise, you must be have a residency program in post-graduation year 1. So I will discuss about the exam dates. This is a biannual examination in spring and the fall season 2021. Now, obviously, we are in the fall season, and the registration window is open right now from the May 17, and it will close on the 3rd of August 2021. Last year, they have extended the dates of closing, but because of the COVID situation. But right now, I'm not expecting this. So be very careful about the dates, and we have to submit the application before the 3rd of August. And the testings, the dates will be open from September 7 till October 11. And I will recommend my participant to select the dates end of September or in the start of October, because it is in between the examination dates, and it will help you to get some the questions which are repeating in the exam. So the repetition of questions will be there. So if you are in the start, you will not get the repetition of exam, the question. Okay. The certification application, there is a fees, obviously $600. And if you, by any chance, if you didn't pass, you have 1 year to go for the exam again, and for that the fees will be $300. But if it will take more time to sit in another exam, it will be again $600. So, and recertification fees is also $300. After the paying the fees, if obviously you will submit the fees once you will submit the application, and once your application is approved, they will send you one letter. You have to fill that letter, and you have to send your transcript from your university, directly from your university, to the US, and then they will verify the transcript. By any case, if you will, if they didn't receive the your transcript before the closing date, it doesn't mean you cannot sit in the exam. You can sit in the exam, you can attend the exam, but your result will not be disclosed until they will receive your transcript. So your result will be withheld until you will your transcript will be reached to the department. So it has actually three domains. Patient-centered pharmacotherapy, before it was 55%, they have raised to 65%. It's a very good news. I feel they've increased the patient-centered pharmacotherapy to 65%. In the last year, it was 55%. Whereas the application of evidence-based practice was 25% last year again now. And healthcare system and public health was 20%. Now it is reduced to 10%. So now we can say the non-pharmacotherapy portion they have reduced. So number of chapters also, it is changed right now. It's no more like before. They have reduced few chapters, and the burden of the coursework is reduced for our new applicants. So there is a chance of a better result in the upcoming exam. Total number of chapters are 21, and course will range from minimum of whenever you will get the marks, how you will get the marks. They have seen that the score will range from a minimum of 200 to a maximum of 800. When I was sitting in this exam first time, I was confused about what is minimum of 200. It means you will get the positive mark. If you will attend the question, at least you should attend. And the minimum passing score is 500. And exam result history, if you will see fall 2020, it is 60%. It's always around 60%. And I hope they change the domains of the exam. So I'm expecting this 60% will be increased to 70% or more. And because of the guidelines and our collaboration, I feel especially our Pakistani pharmacists will get the better marks in the future, inshallah. Exam time is 4.5 hours with the break of 30 minutes. You have to sit for 2.5 hours for 100 questions, and then 30 minutes will be the break time, and then again 2 hours for 75 questions. All questions are MCQs, no doubt about it. What are my recommendation? Actually, I have attempted this exam 2 times. The first time I couldn't pass, and it's very normal with Bcps. And in second time, alhamdulillah, I got passed. And what is my experience, and I want to share with you people, is attempt all the questions. There is no negative marking. Don't think about it. You are going to select something wrong, so I'm not going to select it. Or if you whatever you will select, you will get the mark. So positive marking is there. Instead, there is no negative marking. If you have any doubt, attempt the possible answer and mark the question. So, like for example, if you have any doubt and you want to flag the question, so you have invested your time on the question. You read all the statement, you read all the options available, but you want to review the question again at the end of the exam. So you want to flag it. But I will recommend to first select the answer in your mind. The first time, whatever is the answer, select it and then flag it. It means if you will not get any time to review the question, but at least you will answer the question. If you will just flag it and you will go further and you have no time to review the exam, then it means you didn't select any of the available multiple choice. So then you will lose the mark. Invest minimum time per question. As I have mentioned you how many questions, how many minutes are available. So divide it, and remember you have to be very fast at that time. Details question with the big paragraph, if there is any. So my recommendation, what I have learned from these MCQs of pharmacotherapy, just read the last line of the paragraph first. Why? Because the main question lies in the last line. For example, he will ask, uh, what is the cause of uh, hyperkalemia? Which drug is causing hyperkalemia? So if you know about the main question and then you are reading whole paragraph, then you will pick the right answer. But if you are reading whole paragraph, at the end you know what is, then you get to know what is the question, then you will again reread the whole paragraph. It will just a wastage of time. So I will recommend you just to remember this, that whenever there is a big paragraph, just see the last line, what is the main question is, and then focus on that, because they will give you the other values, other things, just to deviate your mind, or to over accommodate your mind with the values. uh, they want to distract you. So calculator will be available in the system as in a prometric exam. I hope, I don't know right now education system in Pakistan, but when I was studying in university, we have attempted just a written paper. So we never, we don't know about the technology of exam, because the students who are sitting in the international exams, and even for UAE, if they are sitting for DOH and DHA exam, they don't know about the system, whether you can go back or you cannot go back, or you have the access of calculator or not, or how to sit, and how to behave during the exam, how to manage your time, can you use the paperwork, rough work or not. So you should know about it. The calculator is there, and for rough work they will provide you one pencil and paper as well. Maintain the decorum of examination center. It's very important. They can cancel your exam anytime because they are recording the video. Bring some sweets and visit the examination center few days before. Like if you are exam on the 1st of October, just visit the examination center. You should know how far it is from your home. What is the exact location of the center? Might be on the exam day. It happened with me for the first time. I wasted my 20 minutes just because of that. I don't know where the center is. I was roaming here and there and here and there, and then at the end, when I entered in the hall, I was already late. So this is the possible reason of failure as well. So you should know where the exam, the building is for prometric. So it will mean the prometric center, and you should know where is the prometric center in your city around you. And one more thing, I will tell you one more important thing, that try to submit your application as early as possible. Once your application will be approved, then they will send you to take the exam window. Then obviously, might be your prometric center will be overoccupied. Might be they don't have any seat. So at that time, you need to travel to another city or another country. So don't waste your time. Try to submit your application as early as possible, so you will be earlier people. So in the earlier people, you have the opportunities to decide what time of exam, what date of exam, and what is the center of exam. So this is my recommendation. Don't think about the 3rd of August. Try to submit it in the June, or in the coming few days, if you're really thinking about the exam. If you are addicted to the tea, coffee, or anything smoking, I don't want to say, but obviously some people are. So just to remember, you have only 30 minutes of break. So you should know, if you visit the examination center 2 days back, then you just get to know where is the tea shop, coffee shop, and from where I can get it. Because I'm telling you, I never have any exam in my life before for about 5 hours, and it really need take some time, and it's really it will you will be over occupied. Your mind will be over occupied because of the MCQs. It's really very hard to attempt, even to attempt. But be just whatever you people are doing before the exam, take a deep sleep and just free of mind, go there and never think about failure. I'm telling you, never think about failure, because in my first attempt, I feel I was not prepared for the exam, uh, but I feel I should attend it. This is a positive attitude. Always attend the exam. If you pay the fees, then don't worry about this. Just attend the exam. It's very important, because it will tell you where is the center. It will tell you how to manage your time. It will tell you what type of questions he is asking. Then you will be more focused. Like when in my first attempt, um, like I didn't read few of the chapters, and when I was sitting in the exam, then I get to know they were more important than the other chapters that I was thinking more important. Because I told you before, pharmacotherapy was 55%. So non-pharma was 45%. So now it is 65% and this is 35%. Now it's very good for you people. And it will bring the other opportunities. And I hope all of you will get passed in this exam. This is all about the introduction of the pharmacotherapy. Uh, if we have any question, so I hope I will try to answer your questions and queries. Yes, Dr. Siddiqui, can you please see there is any question?
So the first question is, do you have to be in the same ward to be eligible to apply? And is 3 years a mandatory requirement?
Actually, I heard from the some sources, some people said that they even applied before 3 year and the application was accepted. But I don't want to say, I don't want to give you any wrong information about that. If it is written 3 year, it means 3 years. So there should be a 3 year gap in your passing of Form D and right now. Your whatever is the fall or you are in the spring season. And secondly, in the same field doesn't matter. They need just the experience of 3 years. It's a retail, community, hospital, in hospital, different fields, inpatient, outpatient, doesn't matter for that. Doesn't matter. They just need 3 year experience actually.
Do you have centers in Pakistan where you take BCPS or other boards?
Yeah, as I remember, I have attempted my DHA exam in Lahore. It was in Prometric Center in FC College, Lahore, and in Islamabad as well. So majority of the big cities, they have it. Otherwise, once you will submit your application and you are going to take the date of exam, then you will find out in your area, wherever is the nearby your location of the prometric exam center. But all big cities, they have already.
So the experience, if you are working in a community pharmacy, how does that experience count towards BCPS if you can apply for BCPS?
Yes, exactly. We can mention that you are responsible for you are just checking the patient pharmacotherapy or pharmacological or whatever is the prescribing, and this is just you are monitoring the adverse effect, and you are checking drug interaction. Like, even if you are a community pharmacist, this is your job. And it's not something that is not allowed outpatient or not allowed in a community pharmacy. It's obviously it is our job to do. So this is covered in the pharmacotherapy. So don't worry about it that you are working in a community pharmacy, you are not eligible. Not at all. I'm still working outpatient, and I was working in the community pharmacy, and I've applied. Alhamdulillah, they accepted my application, and I got passed as well. Yeah.
So do you, the experience time period starts from the day you graduate or from the day you start a job?
From the date of graduation. It's mentioned on your degree or on your transcript.
So will this exam help if you want to pursue a pharmaceutical industry job?
It can, because if you are in a pharmaceutical industry, because actually I want to say, first of all, Dr. Siddiqui, as you know about it, uh, there are two types of pharmacists. One are the salary oriented, the others are job oriented or whatever. So if you really want to work in an industry setup, I will not recommend these certification. I will recommend you to see the certification that will help you in your profession. If you really want to change your profession from the pharmaceutical industry, then I will recommend you first to change your domain and then come to the certification. This is my suggestion. But still, I told you they need 3-year experience. So don't worry about whatever you have worked, or it doesn't matter, but you must have an experience letter. That is their requirement, and they can check this letter as well. They may contact the employer through the experience letter. All the details are there, so it should not be fake, or it should not be rejected. If it is, then might be they will cancel your certification.
So if I have passed if I completed a pharmacy degree with a 4-year college, am I eligible to apply?
Yeah, 4-year graduation also. Actually, they have mentioned the Form D. They haven't mentioned the B form 4-year. But still, I think so. They can apply for the application, or we can email them and we will get to know about that.
So will Giving Back to Pharmacy in Pakistan be providing any material uh, for these chapters?
Yes, exactly. We are providing from our platform, because the material required is, if you want to study a book, then we recommend the Dipiro. If it is available with you or online, you can download it, or through any source. Otherwise, for exam point of view, this is very important. We have ACCP book, American College of Clinical Pharmacy, and these chapters we have available with us, all 21, and it will be available to our faculty members and our participant as well, without any cost. Don't worry about that.
So there are more questions than we may have time, but let's have a few more. Sumaya Zubair, go ahead. Please unmute your mic and ask the question. Okay, so I guess we'll go on.
Hello,
Can
I'm Smita
yeah,
speaking.
go ahead.
I want to ask about the chances allowed for BCPS. How many attempts we can go for?
I hope, inshallah, first attempt you will get pass, because what is the requirement to get pass? First thing is that if you have right knowledge, guidelines, and you know from where you have to prepare the material and everything, 50% you get pass. This is from the very start of my graduation career. I get to know, if you have these details, guidelines and material, if you have, perfect, then 50% you are passed. The next 50%, depending upon your all your behavior and how much time you give it to the exam, It's not like normally people get in third attempt, fourth attempt, doesn't matter. Whatever we are providing, we are trying to provide you guidelines, we are providing you material. So from our side, you are 50% pass. So next 50% is depending on you. Then you can decide for how many attempts you will get pass.
Okay, is coursework enough for this exam, or clinical ward rounds or clinical experience in practical field is also mandatory? Can anyone having the full grip in coursework can pass the exam,
It's a
or field
positive
work?
thing if you have a clinical experience, if you are working in a hospital, or if you are involved in the clinical rounds. This is something very good. But remember, might be in your hospital the guidelines are different than HCCP guidelines, because they are following the American guidelines. Might be in your hospital they are following the European guidelines. So it is good in other way. But if there is any question, or if there is something you didn't find in the coursework, obviously it will help you from your practical field. So I feel it will help you, but not completely, because the portion is divided into pharmacotherapy and non-pharmacotherapy. So still, if a person who is working completely in hospital, still he need to study non-pharmacotherapy, that that need to get passed. So still there is a it didn't say like somebody is working in a hospital he will get passed completely easily. No, not like that, because it's not implemented still now. The people who are working in the hospitals, I have feel I go through all the course of BCPS, I feel it's not completely as it should be implemented. They are just taking biostatistics or study design just as a for their sake of knowledge, but they are not taking it for their practice. It should be in their practice.
So will there be opportunities to ask these questions in upcoming sessions?
Yeah, exactly. It's we have a group as well, for WhatsApp group for our faculty member, and WhatsApp group for our participants. You can ask these questions, but why we arrange this session is just because once the question is asked, then it's for everybody, because it should clear your confusion about the guidelines and all. So it will help you. I feel it will help you maximum in your preparing the examination.
So I don't have any other major questions, Rana. I think I agree with you. We can get these questions answered in our chat group,
Yeah.
and we can definitely do that. Each session would be is yes, they are all free sessions. Each faculty will present 1 hour to 1 hour 15 minutes on Saturdays and Tuesdays.
Yes.
If you haven't received the email, you will be receiving the email with the topic name and timing with dates for each session. We will be wrapping up by end of August. Is that correct, Rana?
Yes, exactly. We'll wrap up till the end of August, and after the August, in September, I will try to arrange some other meetings. Just we will take the people um, who submitted their application and fees and everything, and they are going to sit in the exam. So we will discuss. We will keep them in touch with us, and all faculty members as well, just for the preparation of the exam, as to discuss some questions, cases, scenarios. So try to help them maximum from our side. But during your you people are doing jobs and very busy, especially in the COVID time. I hope you have a work stress, obviously. So, but still, you people are doing efforts. So we will do some efforts from our side as well to give you a maximum result from our side. I hope this will help you all, and we will finish in end of the August, as Dr. Siddiqui has mentioned. It will take 3 months. It will give you enough time, and I will recommend you people just before starting of class, if your class is on 1st of June, try to read the material. Try to read the chapters before attending the session. There are some questions before starting of the chapter, during the chapter as well. Try to read these questions. Keep some questions in your mind, but be very careful. Our faculty members, uh, they are very busy in their routine work, but they are giving you their precious time. So please try to get benefit maximum from that 1 or 1.5 hour maximum. That 1 hour you will get the maximum benefit. And if those lecture will be recorded, or you will get them, if Dr. Siddiqui will want to add something about the recording and all, he will explain.
Yes, I did that. I did that already, Rana. We are not sure about the e-certificates for each session at this time. However, we will let you know, inshallah.
Yes, Dr. Siddiqui, what about the classes? Because some of the participants, they were asking if they will not attend the class, or they want the recording or something. Because I will recommend, before answering of Dr. Siddiqui, I want you to recommend to attend the live class. Why? Because if you have any question or query, you will ask at that time. After that, I don't want to suffer our faculty members. It's depending upon them. Obviously, they have to taken out some special time for you to answer that question after the class. But in that time, he is with you, and he or she will be with you, and you can ask any question. They will help you in that.
Yeah, I think we can wrap it up, Rana.
I would like to thank Dr. Siddiqui again, to you, all our board members, core members, and especially my volunteers. They are really helping me to make this event successful. Thank you very much, Dr. Siddiqui, and thank you very much to all of you to attend this orientation. And hope from the 1st of June, we will start our regular classes, inshallah. To you, Dr. Siddiqui.
If our volunteer coordinators have anything to say, we can take a minute and say that. Anam, Rida, Priyanka, or Afia, do you have anything to add? Please go ahead. Okay.
अच्छा वाला यूज कर रहा थे ये.
Okay, guys. I think good for the day. Inshallah. Assalamu alaikum. Allah Hafiz.